Welcome to Chapter 7 of Exercise Leadership 2. Let's get the slideshow going. All right, so movement starts from a static base or alignment of body segments. Your posture, right? And so we can do postural assessments standing still. We can do postural assessments while you move to determine how efficient your body movements are during that. And again, your posture when you stand or sit is going to play a big part in whether or not your movement patterns are going to be efficient, effective, and safe. And so again, we start with the basic, getting you to have a good posture, whether you're standing, sitting, in different types of machine apparatuses, how you get in those, so that we can make sure that you don't have issues as you go through. Now, movement screens you're going to see here in a minute. Some of them have some merit, some of them do not, and we'll go through those. All right. So again, this would be a good posture. Now, most people do not really have that good a posture. So again, when you align somebody's posture, some people are going to be more kyphotic. So they're going to have a lot more rounding of or slumping of the shoulders is probably how most people look at it. So you see a rounding of the spine up top in the thoracic area. Some people will be more lordotic, or you'll hear sway back termed sometimes with that. Sway back can be termed with a extreme kyphotic, lordotic. It just depends on the text you're in. But again, lordosis or lordotic back, you're going to see a greater curve in the lumbar region. And these things can cause muscle imbalance. Again, muscle imbalance is a weird thing to really determine. Like I said earlier, nobody's ever balanced. People that work on it constantly are never going to be balanced, because we're always right-handed, left-handed. We always do dominant in our daily lives. So again, when you look at athletes, or if you're looking at a major league pitcher, they're not going to spend, they may throw a ball hundreds and hundreds of times a day with their right arm or with their left arm. They're not going to repeat that same pattern on their other side. Okay. Again, it can lead to altered neural action. So when you do look at seismic, I would say, muscle imbalances, it's just like gigantic one size because of overdoing things. Yes, you can see altered neural action, which leads to dysfunctional movements. And again, most people have tight or shortened muscles because of lack of stretching or use of certain areas, especially when you look at sedentary populations. So these things do happen. Okay. I'm not saying that muscle imbalances aren't legitimate, but there are legitimate, and then there's kind of everybody's got muscle imbalances type thing as well. So again, the lordotic here is not really, that's kind of not the best picture of it. And you can see the sway back. So again, in this book, the sway back has a different meaning than what you'll see in some other text. Again, if you look at the kyphotic back, where it's pulled back, if you look at the bottom part of that, that's more of what you might see with the lordotic. But you can have that anterior, because if you look at a healthy back, the way the lordotic back on this one looks is pretty close, so to speak. Flat back, again, you'll see that a lot of times flat back will also accompany a lordotic back, or a kyphotic back. And then sway back is again, really more of a kind of the way they have it here is you almost have the flat back with kyphosis. So that's their version of sway back. And then scoliosis. So scoliosis is one that you really have to be careful of working with And there's really not a whole lot that we can do from our perspective of help. And to be honest, once you get to really mature adulthood, other than asking somebody to try to stand at the best posture that they can, there's really not much change, if you're going to see any change at all, with trying to help them with their posture. A lot of times, if they've been doing this for decades upon decades, their postures, not going to, you're not going to, again, I mean, always harping on them to stand better might help some, but there's going to be some permanent changes that have happened over time. Okay. So muscle imbalances. So again, this is all based on the fact of what muscles you have, like in these positions that you're going to constantly rely on for stability. And so the shortened muscles are going to be those ones that are constantly being contracted and used. Your inhibited or lengthened muscles are those that are basically you're not using them necessarily at all or hardly at all in the way that you stand. And so with that, they're lengthened. Now, again, this doesn't take into consideration that you use them during movements, but again, because the other ones are always engaged or engaged so much, what we'll see is you're gonna have really limited range of motion. Muscles are gonna be really tight. The inhibited or lengthened ones are gonna have a lot of range of motion, but their ability to engage compared to their counterparts when you're looking at EMG or you're looking at strength in general is or should be limited. All right, not all the time, but can or should be. And so we'll see that in each one of these. Each one of these bad postures is going to have its shortened and lengthened or facilitated hypertonic and inhibited based on how you do things. Now, again, is it always like if you find anybody with sway back or flat back or you know or is it always going to be like this with every single muscle? No, because again, it doesn't take into consideration what they do when they're not standing, right? And so again, a lot of, if they're fairly active and do a lot of things, you may not see this to the extent that it's talking about, right? All right. And again, what you'll notice, somebody that's got scoliosis is you can see how the shoulders versus the hips are out of line. And again, we'd like to see the picture on the right, where your hips are parallel with your shoulders. Now, again, some people that don't even have scoliosis, just because of the way they stand and the way they do things, may have a little bit of you may see like a drop on one side and a hike on the other. But again, that sometimes just has to do with the way they stand, and they kind of have a leg that they like to stand on and a leg that they kind of like rest or relax typically. And so you may see that as well. Okay. So muscle balances, they try to say you're going to see normal length tension relationships and normal force coupling relationships. Again, that is completely determinate on the way that they train, the way that they stand, the way that they do work, the way that they do sports, the way that they train for all those things. It all comes into play. So, like I said, pitchers are always going to be off balance. Boxers are always going to be I mean, athletes are always off balance. If athletes are always off balance, what do you think is going to happen with normal populations? Because again, we tend to do repetitive things in our day-to-day activities, right? And no matter what you do in the gym, no matter what home stretching and stuff you do too, is never going to quite get you what we would say is perfectly balanced, right? But we can do our best. Proper joint mechanics. Again, having, full range of motion, or And again, when I say range, there's not like okay, you got to hit this number, right? Because again, you got to think about what's your day to day. The day to day of a gymnast is different than a day to day of a basketball player, which is different than the day to day of like an oil field worker or a mechanic or a lawyer. Or so when we say range, there's a acceptable range of less prone for injury and things like that. And then there's the range of you're way underneath functional movement. The other thing is too is you can be have hypermobile joints, which can also put you at risk for injuries as well. Okay. Efficient force acceptance and generation comes with proper joint mechanics. So like how if you don't have good joint mechanics and say you jump off a high like a wall or something like that, if you don't have good bend in your knees and hips and things like that, you could put yourself at risk for injury. Again, it promotes joint stability and mobility and will lead to efficient movements. And again, just because everything's aligned doesn't mean you're going to have efficient movements. You have to learn efficient movements, right? There's folks that probably take very good care of themselves, but skill wise, they just have poor mechanical abilities because they're not taught how to do it correctly, right? So again, postural deviations, muscle imbalances, so correctable factors, repetitive movements. Again, yes and no, because some repetitive movements will lead to imbalance, right? Like I said, professional athletes do the same movements over and over and over. And we can't ask them not to do that because that's what makes them successful at what they do. Awkward positions and movements, yes, unless the awkward position and movement is what helps them be skilled at what they do. So again, going back to baseball, some pitchers throw completely overhand. Some are more like a 45-degree angle between horizontal and in vertical. Some guys throw more at the horizontal. Some throw below horizontal. They, like they'll call them like submarine pitchers and things like that. So you got everything from overhand to sidearm to submarine pitchers. And you can't expect to change somebody, especially, if they've made it to the major league level, and because of what they're doing, it's paying them money, right? So sometimes awkward positions and movements exist. Sometimes and it happens in all sports. Side dominance. Can't correct that with people. You can try. You can be cognizant of side dominance, but the thing that is that we have, you're either left or right hand dominant, right? You're left foot or right foot dominant. I'm left-handed dominant. Now I do some things right hand. My guitar playing, I do right hand. I eat right-handed. Those are things that I do right-handed, but that does not compensate for the fact that I write left-handed, I throw left-handed. If I, when I play basketball, baseball, things like that, it's all right-handed. Football is right-handed. Golf is, left-handed, excuse me. All those things are left-handed. And so I'm always going to be left arm dominant, left hand dominant. It is what it is. So again, I'm left foot dominant. So the way that I ride a skateboard or a snowboard or a surfboard, kick a soccer ball, again, because I'm left hand dominant, my jumping leg is my right leg versus my left and things like that. So those are just dominants that will always be there because of years of practice, right? Now, lack of joint stability, we can work on. Again, we can strengthen and stretch and make sure that you have good joint stability, joint mobility. Imbalanced strength programs, definitely, right? If the program itself is imbalanced, then yeah. Now, again, you may purposely imbalance things to try to counteract some injuries and things like that, get that. But again, that's, yeah, we can, the last three, For sure. Um, Repetitive movements, it's just going to depend on what they do. Congenital conditions, yeah, you can't, there's not much we can do there. Some pathologies, some structural deviations in certain types of trauma, no, we will not be able to help correct. So again, when you're looking at somebody, what we want to see is left to right continuity. We want to see horizontal and vertical continuities, whether we're looking at front, back, sides a little bit. I always feel like looking from somebody from a lateral view is always the hardest one to do. So really the key point there is trying to like line up, as you can see, like they're trying to line up the ankle, the knee, somewhere in the middle of the hip region. Again, can be hard to determine on the person based on their size and shape. Kind of the middle of the shoulder region up through the ear, right? So, that lady right there is pretty well balanced, to be honest. Now, perfect, no, but pretty well balanced. The left to right, you can see if you look at the posterior view. And again, it may be the angles. Sometimes somebody's not completely back behind, but it seems like the line runs a little bit closer to her left leg when you look down there versus her right. Again, some might be going on there. Looking from the front view, I still kind of see that a little bit. And again, it may just be that her left leg is rotated anteriorly a little bit slight more than the other one. If you look at the heels on the ground, they don't look quite the same. Her right leg, or yeah, I mean, like her left leg, as you can see, if you look from the back view, you can see the anterior part of her foot going towards the toe, where on her right leg, you cannot see that. So again, those are some things that, aren't quite balanced, but not bad. Static posture assessment, subjective is to observe client symmetry against a plumb line. Plumb line was the vertical line up and down. If you want, some phones actually have things now where you can do that, and you can basically, line it up, take a picture and do that. Or you can always have something like a plumb line hanging in your office or an assessment lab or whatever else to measure against. And it's a good idea because eyeballing it sometimes isn't really the best method. Again, if people's clothes are too baggy, you can't really see, right? Form fitting. So if you go back, I mean, this lady's got form fitting, but it's not like, it's not like super tight fit either. So again, clothing like this makes things a bit easier to assess. So you can see all the different landmarks you're looking for, right? And again, look for gross imbalances first. Again, minor asymmetries aren't a big deal. Again, they may lead to bigger asymmetries in the future, but you can always work on the little tiny things as they're working out. Not a big deal. Okay. So again, static postural analysis, to be honest, I actually don't do these on their own. I usually try to work on like checking someone's posture during every exercise, and then from there, if I notice a tendency of one shoulder to be higher than the other or some left to right things, then I may actually go back and do it. But again, I like getting people working. Most people, when they come in, that's the thing, is they want to get in and start working. So, if you get them moving and then you start noticing, well, this elbow's at this position, this elbow's at this position, or this shoulder, or whatever, these hips, then, I'll do a standing, sitting, like look at some things after the fact to see, is it just during the movement or is it always like that? Right. Because sometimes people just have bad movement pattern, and yeah, they'll lift this while they do this, and then you got to work on that with them. And so again, we, I correct things as we go. Most good trainers, that's kind of typically what they do. If you spend too much time working on the correction of their postures and things and don't get them moving, they're going to get fed up. Okay. We'll talk about movement screens here in a minute, and really what they think's appropriate, I'm going to debunk fairly quickly. We can do muscle length testing, active and passive range of motions. Again, these are things that you do in physical therapy, and these are things that we honestly can and should do, especially when we locate a problem area, right? They don't necessarily have to be done, but if you do locate a problem area, it's a good, these are good tools to use, okay? Again, you can see that they have their phases, right? And again, all 4 phases can be done at the same time during, like from day 1 to day 401, right? All right, so again, looking at pronation, supination. Again, pronation, supination is kind of one of those weird things when we talk about the feet, because in some literature and text, there's no such thing. They feel that pronation, supination only happens at the wrists. Really what it is pronation, supination has to do with the eversion, inversion of the foot with the foot, again, you get the eversion, inversion with some lateral rotation in there. Again, I like pronation, supination. It's kind of how I learned it. Some texts don't buy into it. Depends on the kines books you get into, but this is one of those things that that's the way I learned it, so I like it that way. But this book actually does it, so that's one of the few things that I do like in this book. So toes should be aligned. Any excessive pronation where the arch flattens, again, it's basically the way you'll look at it is you're going to see the foot collapse towards the anterior portion of the of each foot as they stand or walk. And again, it's really hard to do it just from a stance standpoint. Sometimes somebody may have a decent stance, but when you get them walking, they pronate as they walk, or they supinate as they walk. Now again, supination, now here's the thing, pronation is like basically the flattening of the arch, or like if you walk, you walk on the inside of your feet, right? A lot of times it'll push the toes out, you kind of walk duck foot or whatever. Most people tend to walk more duck footed than pigeon toe, but it is what it is. Supination, on the other hand, is you walk along the outside of your foot. So you'll go heel to toe and it'll run along the outside ridge of your foot, which again, if you look at your foot, that's what it's built to do. In all honesty, if somebody supinates, we don't worry about it. So again, even in the shoe industry, they don't worry about it, because what they realize is supination really doesn't come with any major issues in terms of movement pattern problems. Again, in some cases, you may have somebody that is like bow-legged and they supinate the way that things are coming in. But again, you see some bow-legged folks that pronate too. So it's one of those things, when you look at supination by itself, it doesn't seem to have its own issues. Therefore, like even in the shoe industry, we make different types of pronation shoes. We make stability for most pronators. We got motion control for those that have weak ankles and they pronate, and they tend to be, those are tend to be for heavyweight folks, like your overweight and obese folks. Because again, the ankle takes a lot of movement in it. And then we've got the like shoes that you'll see called either cushion or neutral. And the cushion or neutral shoes are built for folks that they're basically built for people that don't pronate. So you either have a normal gait pattern or you supinate. All right. So you can look at the neutral, you can look at pronation and supination. So again, you can see that there's a rotational component that happens with that, okay? And again, like I said, we don't worry much of supination when it comes to movement stuff. Now, again, you can see with the supination, they've got the supinator actually tends to have a higher Q angle for whatever reason in this text, which again, you'll see, most people in general pronate, and most people in general, especially when you look at females, are going to be what we call knock-kneed, or they'll have that high Q angle, as you see on the far right that it's showing with the supination, but you'll see it with more pronation than anything. And so again, yeah, it's a lot of times supination doesn't carry the knock-kneed or bow leg that you're seeing on both of those, and the overcompensated Q angles. So at the from the hip to the knee. Hip adduction. So lateral tilt of the pelvis that elevates one hip higher than the other. Like you'll see it. You also hear it called like a high tip or something. And again, a lot of times we'll see it with folks that maybe have one leg longer than the other, or they stand a certain way, or their spine's offline, like you'd see in scoliosis, or there can be a lot of things. Again, some of that can be correctable, some of it can't. The musculature. So again, some of the things that may cause pelvic tilting, or again, actually, like the pelvic tilting, I'd say is a result of, or results in some of these being tightened and lengthened. So the way that you do things causes the other way. It's usually not the muscles cause the issue. It's usually you do something which causes certain muscles to be overactive and other muscles to be underactive. And you just continue to do those things, right? Again, anterior and posterior. So this one's always kind of a weird one to understand, because so posterior. So we when you're looking at it, you've got to think about anterior tilting actually is where your rear end. Yeah, this is like if you're looking at somebody, like it looks like they're trying to push their butt out, like they're trying to show off their butt, which again, most people want to call that posterior tilt. And it makes sense because we think that we're tilting the posterior out, right? But what you got to understand is that if you're thinking of the pelvis, and especially if you think of the bones involved in the hips and everything else, it's basically your pelvis from like you think the iliac crest and all that. They're tilting anterior, so they're the top of the top of that whole bony section is moving forward anteriorly, which then causes the lower back end of that to shift backwards, right? So that's why we call it anterior tilt. So anterior tilt leads to booty pushing out, okay? Posterior tilt leads to like the like the booty being tucked in, right? And so it's one of those things like like when you think of it, we want to think posterior means you're like pushing more posterior. Anterior means you're pulling more, but it's not. It's the opposite actually. Okay, and you got to think of the bony landmarks of the hip. So the hip is rotating forward. It's rotating, like if you're looking at it this way, where you're looking at the right side of somebody, clockwise rotation is going to be anterior. Counterclockwise is going to be posterior. Okay. Shoulder deviations. Again, people hold their shoulders in different ways. There's the girl standing right there's actually got good posture. We have like if you look at the first guy, he's got the elevated scapula. It's like he's in a constant shoulder shrug. Other dude's got a depressed scapula, so his shoulders tend to sit really low. you know, like almost like it, sometimes it looks like they have elongated upper traps on some folks. Abduction, retraction. So again, and here's the thing, really, to have a good posture, you're going to have kind of a mix of like, if you look at all these, you're going to have a little bit of a mix of slight abduction, and you know, it's just really, you know, it's just really slight, you know, and you know, like, no, you don't want it to you don't want it to be depressed, you want to be elevated, but you're going to have it a little slight adduction in your stance, right, or in your shoulders. Like you can see that that girl is holding her shoulders back just a little bit, not too much, but just a little bit, right? um hey, here's some, if you look at the girl on the right, I don't think anybody stands like that. Now again, I think she's trying to show scapular protraction from the anterior view. Some people do have slumped shoulders and they do pull them forward, but again, usually you're going to have that with like just like a relaxed depression with it is how. And again, her good posture may prevent her from making it look natural, but again, you may see this, you're going to see that type of stance with somebody that's more kyphotic, right? Again, muscles that might be tight, you know, um, uh, like I said, these are pretty typical, but it's not always perfectly true either as you go through there. So again, you know, if you're pulling forward, you know, of course you're going to think, all right, you know, pectoralis major and lats and things, you know, like your lat might be pulling it down forward and things like that. But again, different people may have some different things that they do when they do that. Okay. So good posture. To be honest, her head to shoulder ratio looks like she's being pulled back quite a bit. The I don't know. Maybe it's an awkward picture the way they do that. I would feel that her head needs to be forward just slightly in the first the picture up above and below. But yeah, forward leaning head positions. Definitely the top one is forward, and the bottom one is forward as well. You can see the angle of the neck, right? So again, you can go through all these. Really, the thing is if you want to do postural assessments, you can. If you feel like it's necessary, you can do that. The thing I would challenge you to do is to really weigh what it, you know, like how much like pre-workout stuff do you want to do with the client before you get them moving and doing things. Because again, the longer you put things off, sometimes it can be the difference between them feeling like you're doing your own thing or you're helping them get where they want to go. Okay, so you have to be careful with that, right? So again, consider doing static postural assessments. You don't have to do them. Imbalance and postural deviations. You know, some things you can fix, some things you can't. You know, again, what is imbalance? You know, like I told you before, if you use it as a measure of, you know, is somebody stronger doing a bicep curl versus a tricep extension and things like that, there's mechanical principles that are involved in that, as well as um, just the overall, you know, like this muscle can lift 40 pounds versus 50 pounds or something like that. So you've got to understand those properties as well, which this book's not really going to get into. Length tension relationships, force coupling. So they didn't really, so length tension is going to be basically, you know, like as the muscles being stretched under tension and things like that, you know, like do they lose power, you know, where do they lose power, or strength at certain points. And again, that's going to happen no matter what, but there's a proper amount and an improper amount at certain areas. Force coupling is the use of several muscles to create rotational things. Like you think about like throwing a football or baseball, or spiking a ball in volleyball. There's you have certain muscles that are pulling forward, while other ones are pulling back. Some are pulling up, some are pulling down to create a rotation, right? And so if you have any of those that are overdoing it and some that are underdoing it, you're going to run into either injuries or like mechanical efficiency problems, or a combination of both. All right, that's it for 7.1. We'll do 7.2 next, and that's it for today.